You have the ability to enter a copayment for a patient before a charge is entered for today's visit in the appointment screen or the payment screen. If your practice uses the Practice Manager appointment system, the fastest and most reliable way to enter a copayment prior to charge entry is via the appointment screen. In the appointment screen, you can enter a copay via the Schedule Appointment tab or the Check-in Status tab. And in the payment screen, you can enter a copay via the Enter Credits tab. For this video, we will focus on posting a copayment before the visit charge is entered via the Check-in Status tab in the appointment screen. To do this, click the Appointment tab, then click the Check-in Status tab, and then select the practice, schedule type, and modify the check-in date as needed. The appointments for that day will then be displayed, and any configured check-in times, status or location, and location times will be displayed for those appointments. Right-click the patient's appointment for whom you would like to enter a copay, and then click Collect Copay. Likewise, you can also collect a copay by highlighting the applicable patient appointment and then clicking the Collect Copay button. The Collect Copay dialog will then appear, and the copay amount will default the copay amount that was entered in the patient screen. The credit type will default to copay, the date paid will default to today's date, and the billing provider will default based on the appointment information. You can then choose whether or not to include the payment in the deposit summary, and then enter or modify the amount for the copay if needed. Next, you can then enter or modify the payment type, date paid, check number, billing provider, facility, or case information as needed. The amount, payment type, and date paid are required. Likewise, when entering a copay, be sure that the Print Credit on Patient Statement option is checked. This option defaults as checked and ensures that the patient will not get a bill for their copay before the credit is applied to the charge. To the right in the credit note field, you can enter any additional information pertaining to the copayment collected. For example, if the payment you are collecting is the copay and part of a past due amount, you can explain that information in the note, and your biller will know better how to apply the money. Also, if the patient has an existing credit, you can use that credit for the copay by selecting the Use an Existing Credit for the Copay option. When finished configuring the payment information, click the Save button, or click the Receipt button if you want to print a receipt for this payment. Once the Save or Receipt button has been clicked, a confirmation message will appear for collecting the copay. Click the Yes button to continue. After you have collected a copay for a patient, the Collect Copay option will be disabled for that appointment.